All right, welcome back to Inside ISAPN, your source for all things APRN in Illinois. I'm your host, April Odom, family nurse practitioner and the current president of ISAPN. And in this episode, we will continue our series from clinician to leader, where we are highlighting APRNs who've expanded their roles beyond clinical care to lead in advocacy, education, and professional development. And today I'm honored to be joined by Maiko Yamashida, certified registered nurse anesthetist, and ISAPN CRNA specialty rep. We'll talk about her journey from the OR to organizational leadership, what inspired her to get involved with ISAPN, and her advice for CRNAs and other APRNs who are ready to step into their own influence. Thank you so much for joining us today, Maiko. How are you?
Doing well. Thank you for having me today.
Great. I'll start by asking if you could just share your path from becoming a CRNA to becoming a CRNA. Like what led you into the high acuity settings like trauma, SICU, and emergency care?
I actually had a very atypical start to my career. I jumped into undergrad when I was 17, and people are like, "What do you want to do when you grow up?" And I kind of just picked one thing that I was interested. So I started in cultural anthropology, and then I went into art school. And then I decided I don't want to do either of those things. So then I went into nursing school. And that's where I was first exposed to the various different types of nursing. And one thing that stood out was that nurses can do so many different things. It can be at the bedside, it can be with business, etc. So that was intriguing to me. But I was still so young and fresh and naive. I was just absorbing all the different options out there for us. And my first job in the healthcare setting was as a patient sitter. And then I was a patient care tech, and I was exposed to some of the APRN roles that were in the hospital setting, but I was still in nursing school and just absorbing. And then I got an internship in the ER. So that's really where I got a lot of my foundation. And when you start in the ER as a nurse, you really don't know that the chaos is not normal because it just kind of becomes part of your job and your routine. And that foundation really set me up for success, I think. It allowed me to understand acute care quickly. And where I worked did not have all the resources available. And so resource utilization and acute care really came um, quickly to me out of necessity for the job. And that's where my love for acute care started. From there, I really toyed with different APRN specialties. I thought about doing flight nursing. I thought about becoming an NP, acute NP. So I explored different options and shadowed a bunch of people. Luckily, I was in an environment where people would just let you join. So I was exposed to a lot. But then when I shadowed the CRNA, what really stood out to me was that you really have one on one time, which I think is very difficult in many different nursing settings. And that's what intrigued me because it was one on one time with a patient. And it's a really vulnerable time for the patient. And I really appreciated the care that the CRNA provided, the acute care and critical thinking that took place, as well as the skills associated. So that's my path of how I started.
Wonderful. And so you also are in academia also.
I am.
So how did you get, so you're clinical and academia, which I think a lot of us do. We kind of just juggle all these many hats. And so how did
Mhm.
you end up going down the academia path?
That's another thing, I kind of just say yes to opportunities. My whole life I don't really overthink things when it presents itself, so I just said yes. I was always interested in participating in some role helping the next generation of CRNAs, whether that's precepting in the OR or being on the hospital or university side. So when the opportunity came up for me to be a second reader for DMP projects, I started there. And then I started with lectures, and then I did clinical coordinating. And so during that time, I was full time in the OR as a CRNA, and I did that as kind of like a side gig, if you will. And then the opportunity came up in 2020. So during the peak of COVID, the opportunity came up for me to do an interim program director position. So I decided I was going to use my usual motto and just say yes and see how it goes. So I became the interim program director in 2020. So that really shifted my workload because before then I was mostly in the operating room. And then that acutely shifted to mostly on the academic side and a small FTE on the OR side. So I still keep that FTE ratio where I'm in the operating room a day or two a week, and the rest of the time I'm in the academic space.
And that's kind of like you said, the opportunities in nursing. There's so many things that we can do, and that we
Hmm.
can be clinical, and we can be in, academia, we can be in leadership, and all these different variations of roles. And so, with you doing both, how do you find that balance between clinical excellence and academic leadership? Like, I don't know if you prefer, I know I'm a hands-on person. I like the clinical, but like you said, the academia gives you another look into it. But how do you balance the two?
That's a tough question, and I don't think I would have been able to answer that when I first started. When you first start, I think we're all APRNs are innately just people that want to do really well in everything we do. And so when I first started, I did not know how to balance because I wanted to do 100% over here, 1% over here. Other opportunities were coming up, and I was saying yes to everything. And I did leave to burnout. So I had to take a step back and think about how I can use my time wisely. Um, I had generations of yes or decades of yes, but then I reached a point where I had to be selective of what I say yes to. So that helped. I also realized that I can't do 100% of everything, which is a hard pill to swallow, but I had to manage my time. So I have a family that I had to spend time with, and I was missing out on that. So there was a big reset of my time management that took place probably a year into having both roles. So now, um, time blocking is something that I do very consistently, down to like the micro level of how I'm going to spend an hour to what days I'll dedicate to what. And that has helped tremendously.
That's some great advice. I know a lot of us do just say, yes, I want to do it. I will gladly help you, and not realizing when we need to take that step back and say, well,
Hmm.
no, I don't have time for this or for this. And, as you said, we want to do really good job work all the
Yeah,
time. And you can't give everybody 100%. So something will lack eventually.
for
Um,
sure.
and so, so that was, you started that in 2020. And now, a couple years later, you said yes to joining the ISAPN board, which
Yeah.
we're glad to, because you're an amazing CRNA rep. And so, what kind of led you down that path to say, um, well, first, before you answer that, I wanted you to tell us about, because in Illinois, we also have a CRNA organization and an ISAPN, which is for APRNs. And so tell us the difference in the two organizations, maybe, and kind of what led you to join a board for ISAPN.
Okay. I've been a member for, I don't know, since 2010, 2011 for ANA, which um, automatically has you enrolled into IANA, which is the Illinois Association of Nurse Anesthesiology. And so I've been a member for a long time in that organization. And when I say member, there are variable degrees, right? You can be a member and kind of sit on the background, and then there's member like you're in it, you're thinking about initiatives, you're thinking about how you can participate. And so I've really grown into thinking about the profession and what I can contribute into the future and next generation of CRNAs. But then I thought about, okay, I've been in this space for a while now. What else is going on besides just I don't want to say just actually the specialty of CRNA, because I think sometimes we get really hyper focused and forget to zoom out at times. And so I did zoom out and think about the entity of CRNAs as an APR and a whole organization of what we contribute to healthcare. And I think I was lacking in how much I understood that process and role in the interconnection between different APRNs. And so that's why I became a member of ISAPN 3 years ago. And so it was more of a learning opportunity for me. Because I'm on the academic side, I interact with other APRNs all the time because we have so many different program tracks. And I work with APRNs at work. There's notes, there's consults that happen. But really, from a broader view, I lacked the opportunity to collaborate from an organizational standpoint. And so that's where it all started.
Wonderful. And that's what I think we sometimes forget is, when we're in our specialty, we're in, this
Mhm.
one specialty and not always considering the bigger picture of our colleagues.
Mhm.
And how do we collaborate with them? That's one of the biggest thing I try to promote through everyone is like, we have to collaborate with each other, no matter
Mhm.
what specialty we are,
Yeah.
especially as APRNs, we want to stick together. We want to fight together. We want to support the things that initiatives that you're going for. And then, you support us. That's the only way we're going to continue to, you know, rise together is like,
Mhm.
we gotta do this together in order to make it work. Um,
I think you do a great job with that too.
oh,
I
thank
think you
you.
you really do promote an inclusive environment of trying to understand one another because when we're in our specialties, we kind of get laser focused and the ISCPN has been a great opportunity to learn from each other, and I think you really promote that.
Thank you. Thank you. Well, so now actually then, so how in the couple years that you've been a member and now on the board, how has that helped to shape or support your growth from over the past few years?
It's interesting because I always thought that we were completely different from so many, because I think we self-identify like that, and I think we're perceived that way in general. But actually, there's a lot of commonality. And I learned that when I was sitting on the programming committee for ISAPN. And so there are many different APRNs there. We're working together to create an awesome conference. We're looking at content. And then while I'm looking at the presentation topics, I realized that there are some that I would want to go to and I would learn from. And it opened my eyes to how we have a lot of commonality. If you think about it, we have one patient that we're taking care of in multiple different ways. So we have to have some kind of interconnection and commonality, but we don't really think about it much when we're thinking about our specific sector. So through ISAPN and the programming committee, it's really allowed me to look at things from a broader perspective and realize that we can definitely learn from each other.
Mhm. And I want to mention, I know that again, this is why having specialty representation on the board is important because you and our CNM, rep, you guys advocated for us to have the CE available for your specialties at conferences.
Hmm.
And
Hmm.
again, ISAPN, we mostly have, even though we represent all APRN specialties, the majority of our members are certified nurse practitioners. And so, as you
Hmm.
said, we get laser focused on our needs and not always remembering to consider our colleagues' needs. So again, that was, one great thing that you all done. So this year at conference, we're going to have CE available, continuing education available for CRNAs and certified nurse midwives also,
Hmm.
which is a huge thing because again, if no one ever mentioned it or no one ever said, hey, we need this, it wouldn't happen. And again, that's how
Hmm.
we make sure that we stay intertwined. So I thank you for that because you guys did some
Absolutely.
awesome work on that as well.
And it was a quick turnaround. I remember the board meeting. I was like, hold on, guys, can we fix this? And it was absolutely. And then Susan got to work. So it
Yeah,
was,
I think that's what people forget sometimes. It's like, like people will say, oh, this isn't happening. But until you say something about it, no one sees that there's an issue. We just think
hmm,
everything's okay.
yeah.
And so that's why we need people to speak up and, use their voice and say, this needs to change. And then
Hmm.
we get to work and change. And so that's what we do for our state of APRNs in the state of Illinois for sure.
I'm definitely your girl for that.
Good. And so again, as you mentioned, like just how all the different specialties intertwine and how we work together. What's one piece of advice you can kind of give us and how the four specialties can work together more effectively to advocate for patient change, like for, the patient access and patient needs?
I think we have to start from the educational level and making sure that we're really well trained. Patient safety always has to come first, and part of that is how we train. And within that training, I think it would be helpful to understand the role that each of us play. So, for example, in on the university side, there could be classes where everyone takes it together, like health assessment, for example, or understanding the APRN role. That's the perfect opportunity to understand what we do and interact with one another. So when we are out practicing, it's not the first time you've interacted with another APRN. Um, there's also, I think, opportunities to present together. I have never presented with an NP before, but I will be in October. And we're sharing the same patient. So this is mimicking actual practice. We're sharing one patient, and the nurse practitioner that I'm presenting with is talking about the medical management side, and I will be talking about the anesthesia surgical side. So more of that, I think, will lead to strengthening how we can prepare as APRNs. And I do think that it starts from the education system, though.
Yeah, that's great. That's a good idea. I'm excited to see that too, because again, learning how, even though we're nurses, we're APRNs together, but we have two different perspectives, but we can still
Hmm.
take care of this one patient.
Yeah.
So that's amazing. Yeah. And so thinking about, like CRNA perspective, again, you are your own specialty. Yeah, you're an APRN, but you're a specialty. What unique perspectives do you bring to leadership?
I think that there's a lot of I think there's a lot of leadership opportunities both within the CRNA specialty, but also APRN, and then even bigger than that, and within healthcare systems. And so having a CRNA presence within like the C-suite, for example, would be incredible, just because we have a lens for what happens within an institution in the operating room and anesthesia, the role that APRNs play there. Within medical systems, I don't want to say workhorse, but the main conductor of the money generator, there are procedures that happen within the hospital system, and anesthesia is required for that, and CRNAs provide that. And so I think having a seat at the table to talk about what we do is important in terms of leadership within the hospital system. Um, and from outside of that, there's more opportunities. Like the Lake County coroner is a CRNA. There's so many different opportunities that we can look into to serve as leaders. I think we think about just the hospital setting or academic setting, but there's more than that. CRNAs have sat as provosts, deans within colleges of nursing across the country. We've also sat on different leadership positions and nursing boards. And so having that take within leadership, but having the CRNA lens can be helpful.
Yeah. And, having, like you said, it starts with education at the educational level too. So as faculty partially, what, I guess, because I just recently became faculty last year in September, and it's different, as you said, like we have psych, mental health, women's health nurse practitioners, and certified nurse practitioners in this group. And we've had conversations of how psych sometimes says, well, I don't need to take advanced health assessment because
Hmm.
I'm only going to be doing, but it's like you still need that information, you still need that
Hmm.
education. And
Hmm.
so being for you in your area, like what excites you about the students who are coming up in this profession for CRNA?
It's interesting you mentioned the health assessment thing, because I remember as a student forever ago thinking like, why do I have to learn this? And then I realized like, no, I do have to, because I'm going to be an APRN. I'm not going to be just a CRNA. So I mean, it took forever to understand that after graduating. And now my students ask the same thing, like, why do I have to take health assessment? I'm like, because you are going to be an APRN and you have to take these classes. You have to understand the system as a whole. And it also contributes to how you provide anesthesia. You cannot safely provide anesthesia if you don't understand all the systems and how they work together. And so as a faculty member, it's kind of funny that I'm saying this to students, because I remember asking the same question to myself. Back then, you don't ask questions like that to faculty. You just think it in your head and you move
Yes.
on. But now it's different. But it's just funny how people have the same question, and really, that's the answer: is you have to have a general knowledge base about the entire system to become an APRN. But what excites me about being a faculty member and being a contributor to the next generation is I'm able to really contribute to the workforce by thinking about social determinants of health and different health equity aspects that I think are lacking within our healthcare system. And I'm able to integrate that into our curriculum. Um, and it's also exciting for me because there are people that come in that are really passionate about education or professional development or whatever it may be. And we're really able to grow them as a person because the goal is not to just get a degree, it's to get an education. And part of that is also the personal growth that comes with that. So if someone is really excited about education, I had a student year one, she was like, I want to be a faculty member. And I'm like, okay, well, let's get through school first and then let's practice a little bit, but now she's a faculty member.
Good.
And it took years in the making, but we were able to help her and mentor her through that. And I think that is another exciting aspect of being a faculty member and how you can contribute to the next generation.
Because we need them. We need, solid future for the, in clinical practice, in education, in leadership, in all these different areas.
Hmm.
And as you said before, these are all areas where APRNs need to be. We need to
Hmm.
be in all these different settings and settings that you don't even think of all the time.
Yeah.
So we just have to spread our wings and, try something new and, say sometimes say yes to things.
Yes, that is
Uh,
true.
yeah. All right. So, lastly, what advice would you give to new or aspiring CRNAs who want to step into leadership roles or organizational leadership?
I think first you have to dig into what you're passionate about. There are a lot of there are different ways to be a leader. Sometimes there are quiet leaders, sometimes there are louder, more visible leaders. You have to think about what kind of leader you want to be. And then you should also think about what you're passionate about because that will guide the position you would seek. So for me, it was always important to contribute to the health equity lens of practice. And so that's what really guided me within how I practice, but also how I teach students and the curriculum. And so that's how I identified what was important to me. But others have different things that they're passionate about, and identifying that and then finding a mentor is really important. I would not be here without people that have mentored me. And so those would be my two things of advice.
Yes. Thank you. Thank you. Thank you so much, Michael, for sharing your insight, your experience, and your passion today. Your commitment, of course, as I said, to elevating the CRNA voice and making sure your specialty is represented and heard while mentoring the next generation is exactly the kind of leadership that our profession needs. You remind us, me, that APRNs, including CRNAs, belong at every table where healthcare decisions are being made for our patients.
Mhm.
And again, we have one goal. I always say this all the time. We're all APRNs at the end of the day. And our one goal is patient care, patient access. Like, so no matter what specialty we are, that's what we should be out for. And so, to our
Absolutely.
listeners, whether you're in the OR or the classroom or the boardroom or leadership, your voice matters. And ISAPN is here to help you make it heard, to help you hear it. So, visit isapn.org to learn more about how to get involved, connect with your specialty rep. If you're a CRNA, uh, please direct message Michael, see what she has to say to help you grow your leadership journey. And thanks for joining us on Inside ISAPN. Until next time, stay connected, stay informed, and keep leading forward.
Thank you.